Welcome to Genomics Now, a podcast series where you can learn how genomics is developing in England's NHS. This podcast series, recorded in 2021, is part of the North Thames Genomic Medicine Services Educational Toolkit. In each 10-minute episode, we explore what is changing in genomics. We answer the questions on genomics we've been asked by the different healthcare professionals. We talk about the ways genomics may impact different healthcare roles and how genomics can be used to successfully improve patient care.
Hi, I'm Anwar Khan. I'm a GP in East London.
Hello, I'm Dahlia Hopmeier. I'm a clinical fellow in genomics at Great Ormond Street. And what we're going to do today, we're going to talk through episode 1 of the Genomics Now Primary Care Genomic Medicine series. And episode 1 is the role of genomics in primary care. And I just wanted to start by saying that I think GPs and primary care as a specialty has a very key role in being one of the main drivers in supporting equity of access to tests. I just wanted to start by introducing the concepts of genetics versus genomics, because we use the words quite interchangeably and we will be using them throughout the podcast series. But so basically genetics is the study of heredity or the inheritance of traits. And in general, it's the study of the function and composition of single genes, while genomics is the study of an organism's complete set of genetic information. So this includes the genes, but also genetic material between genes, and that can also influence how the genes work. So we can think of this as genomics referring to the complete genetic information of an organism.
That's helpful, Dahlia. But in what role does genomics play in primary care, do you think?
Well, so there are lots of new developments in genomics, including the launch of the Genomic Medicine Service, which leads to increased access to testing. And so it's becoming increasingly important that GPs are aware of the role that genomics does play in healthcare. More patients are having genetic testing, and the knowledge of genomics is becoming more widespread. So GPs are going to encounter more patients, and they may have questions about genomics or may require referral to a clinic genetic service. It is also likely that increasingly GPs will see patients with a genetic diagnosis.
So do you have any examples of scenarios that we might encounter?
Yeah, so there's really quite a wide range. But for example, about 1 in 17 people have what we would think of as a rare disease. And about 80% of these conditions have a genetic basis. So even though each disease individually is very rare, collectively they are quite common. So it is likely that most GPs will see some patients with rare genetic diseases. And general practitioners will also play a very important role, as they may be the first ones to identify signs that prompt referral to genetics. And they will likely also play a supporting role throughout the individual's lifetime. And in fact, this does already happen in common practice. There are also many common conditions that might have an underlying genetic predisposition. For example, about 5% of all cancer cases are familial, or what we might think of as inherited. And especially patients who have young onset cancer, or a family where there are a number of cases of cancer or certain patterns of cancer, such as breast and ovarian cancer that occur together, these patients may need referral to clinical genetics. And furthermore, some patients may need prescriptions or to be enrolled in screening programs based on their genetic diagnosis. And this is one of the scenarios in which general practitioners are very valuable in facilitating these processes. And it's really the joint management between general practice, clinical geneticists, oncologists, etc. So it's quite a multidisciplinary team approach that's needed, with general practice playing quite a central role. Another thing to mention is pharmacogenetics. And this is the use of genetic information to guide prescribing of medications. It's becoming more used in clinical setting, and it is likely to affect how GPs do prescribe in the future. And then one other topic I wanted to touch upon, which a lot of general practitioners I know are interested in knowing more about, is direct-to-consumer tests. And these are commercially available genetic tests, which are becoming more common. So the general practitioner may be asked to interpret results or to make recommendations based on results. And we do have some more information in another podcast about this.
I mean, people talk about the GPs actually having a more increasing role in genetic testing and in diagnosis. Do you have any examples of that at all?
Yeah, so thanks for asking that. There are quite a few scenarios in which this is going to be very important and is already starting to be. But for example, part of the NHS long-term plan is to improve identification of individuals with a condition called familial hypercholesterolemia.
Oh, yeah.
Have you heard of it before?
Yes.
Yeah. So this is an autosomal dominant genetic condition which causes premature coronary atherosclerosis due to high LDL cholesterol levels from birth. It's thought to affect about 1 in 250 people. And if you can identify these individuals and treat them early with lipid-lowering therapies, you can significantly reduce mortality rate. So we can see how it would be very important to be able to identify them. Now, at the moment, it's estimated that we are only identifying about 7% of people, but there's an aim to improve this to at least 25% by around 2024. So GPs will be key in identifying the patients who are at risk of familial hypercholesterolemia and referring them for genetic testing, which then enables treatment of the patient, but also allows testing of their family members who might not be affected by any symptoms at the moment. And we call this cascade testing.
Which reminds me, I mean, I gather there is an underdiagnosis of people at risk, isn't it? I mean, I think at the moment, prevalence studies suggest about 1 in 500. So I suppose we as GPs have a big role identifying them early, isn't there?
Definitely, that's exactly right. And as you mentioned, we used to think it's about 1 in 500 because we weren't identifying people. And now we understand it might actually be double that. Yeah. Another point, which I think some general practitioners may not be aware of, is that you can also order genetic testing yourself without the need for referral. And the one condition that this is now authorized for is hereditary hemochromatosis. There is a document called the National Test Directory, which describes the clinical criteria that are required and the genetic tests that can be ordered. And this is the same throughout the whole country. So this is also a good example of what we call mainstreaming, which basically means that we're trying to enable healthcare practitioners in specialties other than genetics to be able to order tests for their patients themselves.
And given the important role of GPs, where can GPs go and find more information about genomics?
There are lots of resources available. I'd like to point you towards the North Thames GLH website, which has a good list of resources. The Health Education England Genomics education website has lots of useful information, and I particularly like their A4 fact sheets on common genetic conditions. And these are quite useful also to give to patients, so you can just print them off in the practice and hand them over. There are lots of online courses available. One platform for this is futurelearn.com. And then the Royal College of GPs has put together a genomics toolkit themselves. And this is, of course, very targeted towards general practitioners and has lots of useful information on it.
Yeah, and actually on that note, if I may say, Professor Steve Humphreys is doing some work with the RCGP on familial hypercholesterolemia with Great Ormond Street.
Fantastic. Great. Thank you so much, Anwar. Good to talk to you today.
Thank you very much.
Thank you for listening to this episode of Genomics Now, a series of conversations hosted by healthcare professionals of the North Thames Genomic Medicine Service. Our aim is to complement other genomic-focused educational tools with bite-sized podcasts that explore how clinical genomics is developing in England's NHS. If you have any suggestions for topics you would like us to develop as part of the Genomics Now podcasts, please let us know. Also, we'd love to hear about the episodes you've enjoyed and how they have helped you with training. Please get in contact with us on the link given with this podcast or tweet us at North Thames GLH. You will find this and other educational resources at the North Thames GLH website.